We've reported extensively on the high number of overdoses in Northeast Ohio connected to heroin and fentanyl. But there's another substance killing a lot of people: alcohol.
Yeah, in fact, a local coroner is alarmed by the high number of deaths he's seeing because of alcoholism. As Bob Jones reports, experts believe lingering problems from the pandemic are leading to more struggles.
Turning to alcohol more frequently during the 3-year pandemic became a serious problem in Northeast Ohio, according to substance abuse experts. Tammy Hunter with Town Hall 2, a prevention, treatment, and recovery facility in Kent, says many people abused alcohol in part because of fear, anxiety, and isolation brought on by COVID. And those feelings have lingered for some.
It's a mixture of COVID, people struggling to manage stress and having a lot of responsibilities and not, really having an outlet to manage.
While the government ended the COVID-19 public health emergency declaration in May, a spike in the struggle with alcohol is present in Portage County, according to the coroner. So are you at a point where this is alarming to the community?
I think we've passed that point.
Dr. Dean DePiro says this year alone, the coroner's office has handled 14 chronic active alcoholism deaths, 12 men and 2 women between the ages of 47 and 71. In a typical year, there are only 4 or 5 cases. And the cases reported here to the coroner's office are only a fraction of the alcoholism-related deaths. Dr. DePiro says for every case he sees, there are 9 others in which private physicians signed the death certificates.
It seems that the after effects of the pandemic are still with us. We had a lot of social isolation with individuals, and I think that in this instance, alcohol has become a medication.
And the number of people seeking treatment for substance abuse is way up at Town Hall 2. 850 last year, already 1,000 this year, the most the agency has ever seen.
A lot of trauma. Everyone's cycles of trauma are different and how they cope with it.
Dr. DePiro says a major focus right now is eliminating the stigma for those who need treatment.
Reaching out for help, or if you know somebody who might need help, is the most important thing that you can do.
Hunter stressed if you don't know where to start, call the crisis hotline at 988 or 330-678-HELP.
Mental health and substance abuse treatment is healthcare, and reach out, get help. People are there for you. Whatever community you live in, someone is there to help you.
In Ravenna, Bob Jones, News 5.
Doctors say excessive drinking during the pandemic led to a dramatic increase in alcohol-related liver disease. In fact, that condition has passed hepatitis C and fatty liver disease as the #1 reason for liver transplants. And the number of people needing transplants has skyrocketed. For example, consider these numbers from the University of Colorado Hospital. Before the pandemic, 40% of patients screened for alcohol-related liver disease needed a transplant. A few years later, that number is now anywhere from 80 to 90%.